Welcome to the state of Ohio. I'm Karen Kassler. A new report says Ohio's poverty rate dropped a bit between 2022 and 2023, but it's still higher than the national average and has been since 2007. The Ohio Association of Community Action Agencies' annual State of Poverty in Ohio report notes that living in poverty shortens lifespan, with a 12-year gap between the average life expectancy in Delaware County, one of the state's wealthiest, and rural Vinton County. I talked about the report and some of its conclusions with Phil Cole, who's been the executive director of OACAA for 36 years. He's retiring at the end of this month. Talking about this year's State of Poverty report for Ohio. The poverty rate has dropped only slightly from last year's report, 13.3, down from 13.4, but that's not the focus of this year's report. In fact, it's rarely been the focus of the State of Poverty reports that you've put out, and I have a couple of them here in this stack. This year's focus is on resource deserts, which is defined in here as people living in these deserts lacking a key resource essential to their well-being, which forces them to put more of their time and energy into getting food or medications or other resources to survive. And the report also says this can have a cumulative effect. Tell me about resource deserts and why you're focused on that in this report.
We're focused on that because poverty is something we all know about, but most people don't realize it's a human creation. People say, oh yeah, people choose to do bad things, they make bad decisions. Well, some people do, all right? But most people who are in poverty were born in poverty, and as far as I know, no one ever chooses who their parents are or where they're born. And I think there was a Pew Research study that said 68% of all people born in the lower half economically in this country will never get to the upper half, not even for one day. So we said, why is that? What is it that holds people back? And we began to look at these deserts. And like I said, poverty is created by human choices, not by those who are poor, but by public policy. There was a big employer around 1900 called A&P. People have heard about that. Some people have heard about that.
You're talking about the grocery store
big
chain?
Grocery store, big grocery store chain. And they began to do something which is going on right now, but Congress said, no, you can't do that. And that was require their food suppliers to give them better prices than they give anybody else. And Congress passed a thing called the Robinson-Patman Act of 1936, which said you can't do price discrimination. If you're gonna, what you give A&P, you got to give Bob's Market down here. And so you see, when I was a child many years ago, there'd be all these little grocery stores in neighborhoods, and in the 1980s, under the Reagan administration, they said this Robinson-Patman Act thing is not efficient. So they said we're not going to enforce it any longer, and they encouraged efficiencies, as they called it, by saying if you buy big prices, you get better deals.
Which creates Walmart and Kroger
Right.
and these big chains.
Right. And Walmart, Kroger, Safeway, they pushed the little guys out of business. And so that created these food deserts. Also created some unemployment too, because those places were gone. And that became, that was the first part of the effect of not enforcing this law any longer. And then it became other things. You see now in Ohio, especially, the pharmacies disappearing. These pharmacy benefit managers who just set prices, and this was debated for a while in Ohio. The General Assembly looked at it and then did nothing. You also have maternal health care deserts. There are legal deserts now. There's no lawyers. I think in Vinton County there are 2 lawyers. I was over at the Bar Association talking to them about this, and I about fell over when they showed me these numbers. There are just so many problems, so many deserts now.
Yeah, and you even cite in the report behavioral health care deserts,
Yes.
transportation deserts, where there's no public transit and people have to have cars to get anywhere, and that's an expense that some folks can't absorb. I want to put some actual numbers on this. Food deserts, which is what you started talking about. 67 counties have at least one food desert, and nearly all food deserts are in areas where the poverty rate is at the state average or above. 41% are in areas where the poverty rate is double the state average. So these are in areas where people are already struggling.
Right. And the struggle gets worse because since there's no grocery store around, they're buying at They buy fast food, getting fast food meals, or they're going to Dollar General, which Dollar General is a nice store, but it's not known for its fresh produce. It's not known for its healthy food. And so this leads to other problems, those are usually medical problems, obesity, malnutrition, those kind of things, which compounds all the other problems. You need a doctor, but the doctors aren't around. And when you do get to a doctor, they prescribe a drug, but there's not a pharmacy.
Yeah, and the pharmacy desert. 67 counties have at least one pharmacy desert. Yeah. And there's been a 16% drop in pharmacies across the state over the last decade because a lot of these smaller independent pharmacies have closed or pharmacies have consolidated because of large chains purchasing them. But this is not just a problem in rural areas. You're seeing this in urban areas as well. And that's the case for food deserts too.
Right. Actually, it's a bigger problem in urban areas. It's just because they just say that we're not going to be profitable being in these places. We're much better if we go out in the suburbs or in certain places in the cities, build the bigger stores, offer more things, and people can come to us if they can get there.
What can the state do about these things, though? Because like you mentioned, the food desert situation was created in large part by federal policy changes. What can the state do about these things?
Well, first, let's see, you mentioned federal policy. The Trump administration could say we're going to enforce the Robinson-Patman Act because it's still there. They can enforce it. They can enforce the law. Congress can pass something else even tougher. The state can pass. The state's always big on tax cuts. We love our tax cuts in this General Assembly. They can offer real tax incentives to some of these grocery stores or to these food suppliers, or they could say you can't favor one over the other, which would be the best way to go. I wish they would.
And you mentioned PBMs, pharmacy benefit managers. The state has not taken big action on those. Is there something the state could be doing to try to help people have better access to pharmacies?
Sure, they can. I mean, it's the same thing. First, you could regulate pharmacy benefit managers. They just chosen not to do it. They say you can do price discrimination if you want. You can favor your big customers over the small ones. They can stop that. They can make that illegal.
And some of these other deserts, 60 counties have at least one pharmacy desert and one food desert. Yes. Plus you have these other ones that you mentioned, maternal care, legal assistance, behavioral health care, transportation. These are huge areas where can state policy really make any difference, or how, you would have to have wholesale changes in some state policy for some of these things to make a difference? I mean, public transit's just not available in some parts of the state.
Well, you're right. You would have to have wholesale changes because because they put off the problem so long. If you have to do solutions, and the longer you wait to do your solution, the harder it is. We could do transportation. I think about the time I went down, I was Jackson. I looked at this little railroad station they still had there. I think it was Jackson, either Jackson or MacArthur. They kept it up. It was really beautiful, but it was a way to get to Columbus. Of course, it's gone now. The state can rebuild those things. Why they won't do Amtrak here just baffles me. That would be a good start to get people from Cleveland to Columbus and have all the stops in between, get people around to different places.
All these things cost big money, though, and the state leaders have been talking about cutting the income tax, eliminating the income tax, property tax cuts, and relief. I mean, this is stuff, you're talking about investments that would cost big money.
Right, that's exactly right. I'm not going to shy away from it. Yeah, if they would have done it before when they first knew about the problem, they'd be solved by now. The question is, are you going to solve the problem, or are you just going to let it fester?
And over the years, you've done how many of these growing up in these state?
32 or 33.
So over the years, I've kept a couple of these editions here. In 2024, you talked about growing up in poverty, specifically focused on kids. Yes. 2023, vulnerable to disruption, learning loss, mental health, transportation. This one was interesting. 2022, the face of poverty may surprise you, about people who are at risk of going into poverty who you might not suspect. I mean, what are some of the things that you think people don't know about those who are in chronic poverty or come in and out of poverty?
People don't realize that. Well, there are the two types. Most people in poverty were born into it, right? And they're not going to get out of it. It's going to be hard anyway. That you can really work at it, but public policy is making it harder, because the best way out of poverty is education. Yeah, we did in one of our reports several years ago. We talked about how I think I pulled Miami University out, and I said in 1980, whatever it was, the state paid over half the cost of an in-state student to go to Miami. Right now, it's less than 10%. which is one of the reasons for these jacked up costs for students. Nobody can afford to get an education anymore. If you do, you come out with these big debts. There's so many solutions, and they're there if the General Assembly will just realize that total libertarianism is not the way to go in a free society. If you want to be a democracy and you want to have a real free society, you've got to support the society.
You mentioned at the beginning of the interview about poverty is because of choices. Some are policy choices, some are personal choices. People do make bad choices. That, I think, is the focus of a lot of folks when they think about people in poverty. Well, they could have made better choices. They could pull themselves up by their bootstraps, that kind of thing. Do you respond to that? You kind of shook your head there.
That's a nice thing to say, and it used to be true. It's not as much anymore. Like I said, most people in poverty were born there. You can't pick where you're born. You can't pick who your parents are. And we've made things, like I said, public policy has made things more difficult. So if you end up in a bad situation, it's harder to get out if it was your fault or not. You know?
You've been doing this for 36 years. Mm-hmm. What is the one thing that you were hoping to see get resolved or move forward in some way that still is unresolved as you leave this position?
Well, I was hoping my hair would turn back to its regular color. But I'd really like to see them come up with more support for education, because that's such a way out for people. Bring back affordable colleges. Yeah. If Ohio is no longer going to support public education, like I said, Miami was over 50% of the cost. Now it's less than 10. Is it still a public university? Yeah. We need to do that. We need to make sure people are fed. We need to make sure people have affordable housing. There's really not just one thing. I mean, Karen, it's just a question of when are we going to quit putting off the solutions? We've got to quit living in this dream world that if we cut taxes, everybody's going to benefit.
But Republican legislators will say, hey, we did cut taxes. We eliminated income taxes on people making under $26,000 a year. Taxes are now lower than they've been, going almost back to when income taxes were created in Ohio, and that's helping create jobs, which will help Ohioans. They say they're doing policies that will help people get out of poverty.
We've our poverty rate has trailed the national average for 18 consecutive years. So how's that tax cut working?
Cole says one thing he thinks could help is if term limits were repealed, which he says would keep lawmakers and the institutional knowledge they hold in office longer.